Hello, my name's Janine McKnight-Cowan and I'm a health visitor, and we're here today to talk about Five Guide. What is Five Guide? Five Guide is an innovative visual tool to enhance caesarean section recovery. It's a tool that health visitors, midwives, obstetricians can use in practice to help spread a visual narrative on enhancing caesarean section recovery in the community. Why do a workforce development video? Well, it's a new era that we're in, and obviously we need to get consistent educational messages shared amongst professionals. The message is transferable to midwives, GPs, obstetricians, student health visitors, other health visitors. It's a sustainable approach where there's a consistent message that we're sharing. It is a much more financially secure way of delivering a training, and we can ensure that quality and equity of services being transferred across the counties and nationally. Currently, more than a quarter of all babies born in the United Kingdom are delivered by caesarean section. Better Births, a new National Health Service report, sets out a vision for birthing women. It's where every woman, every pregnancy and every baby is different. Therefore, the quality of the information they receive should be specific and unique to fit their needs. NHS Choices developed a downloadable leaflet called Recovering from Caesarean Section. Women are informed that they need to take things easy for a few weeks. They are informed on how to care for their wound, how to control any pain and bleeding, how to return to normal activities, and when and who to seek medical advice from. Five Guide demonstrates a gap in the rhetoric and reality of patient information to support women's recovery from a C-section. Health visitors can and do care for women antenatally and postnatally in the transition of care between acute and community sector. The take things easy narrative isn't always understood by women. Five Guide impacts clearly a simple visual narrative. It's cost effective, it's sustainable, and it's a clearer health promotional tool. So, what is Five Guide? Five Guide is the visual narrative to explain to a woman that she's had surgery that involves 1, 2, 3, 4, 5 layers. Those 5 layers of healing are your skin, the outer layer of the skin, your fat layer has been cut through, your muscle layer, your peritoneal layer, and then into the womb to deliver your baby. So Five Guide is the visual narrative of our anatomy. And when we're explaining what is Five Guide as a recovery, it's not a leaflet, it's a consistent visual tool that's with a clinician all the time. So five layers, Five Guide, you've got it all the time to explain to women. Your skin is healing, so you can talk about the signs of infection. You can talk about your fat layer has been cut, so if there is any oozing of the wound. You can talk about your muscle layer if there is any pain or discomfort. You can talk about the peritoneal cavity. Be specific on the anatomy so that a woman understands what has actually happened to her in surgery. And then obviously our 5th cut is through into the womb to give us our newborn baby. So a lady who's had a caesarean section has endured a lot of surgery. 5 layers are going to take up to 5 to 6 weeks to heal. And any bruising, any pain, any discomfort, you get a woman to have a sense of appreciation of what has happened to her in surgery. So the narrative of take it easy, when a woman is going to do her hoovering, wants to carry the shopping, wants to do the washing, reminder that she's got 5 layers healing and she does need to take it easy.
I've been qualified as a health visitor for 8 years now, but I've worked within health visiting teams and community practice for 11 years. I've recently completed the 5-Guide training. Prior to using 5-Guide, I would usually refer women back to the midwife for support with post-section care, or provide them with written information, or direct them to the written information they were discharged with from the hospital. I feel 5-Guide has made quite a considerable difference to my practice, because I not only use it postnatally, I also use it antenatally now as well for mums who are going to have a planned section. So I can explain to them before their delivery that there's going to be that 5-part element to the surgery and the kind of care they will need for that recovery afterwards as well. For mums that have had an emergency section, they're quite often discharged with very little information, so being able to use again the 5-Guide to explain to them how much rest they're going to need and help they'll need in those early weeks has been vital in supporting these women.
I've been a health visitor now for just over 4 years. The lovely thing about 5-Guide is that you've just got it with you all the time, and then you can convey that to parents as well. So just having this hand up is a really clear symbol to women that this is the 5 layers that have been operated on and need to heal, and it's a very clear message.
I think 5-Guide is so simple and easy to use. We've all got a hand we can show and just point out the different layers that are affected by a section delivery, and the mums can look at their hand. Dads have been involved as well. I've had families where I've delivered the information to mums and dads, and when I've gone back to review the family, dad's been saying, I keep telling her 5 layers, 5 layers, so they're all able to remember it really easily using that simple showing the hand.